Hey guys, Annie in Tucson. I am going to do a quick video to answer some questions that I've gotten from people, multiple people, and I feel like just throwing a video out there is going to be a little bit more efficient than me retelling this story a ton of times when I have a lot to get done this weekend. So if you don't know me, I'm not sure why you're watching this, but I'm Annie Bates, diagnosed with breast cancer a couple days ago. So I'm not going to talk about my treatment and what's coming ahead. I'm just going to talk about what led me to the diagnosis, what symptoms I was having, and what made me seek medical attention. Also, I got this haircut last night. I don't know what I'm doing with it yet. By the time I learn what to do with it, it'll probably all have fallen out. So I have cancer, so be nice. Thanks. The history with these is I had my first mammogram in 2021. That's when I was 40. And they did mammogram. They did find one small lump in my right side, which had been there when I was in my 20s. I got it looked at when I was in college, and it was a fibroadenoma. I hope I'm saying that right. They put a marker in it. They did a follow-up mammogram on my right side. All was good. The last mammogram I had done was December of 2022. Totally routine. Nothing was found in either side. Yeah, so I've been pretty good about it. I had my most recent gynecology appointment was also a few months ago, and she felt me up as well. I think that was about 4 months ago. So my first symptoms started July 12th. I am going to be talking about boobs, nipples, and periods. So if that makes you feel uncomfortable, turn this video off. Also, I don't know why you'd be watching this if those things made you feel uncomfortable. So July 12th, I started my period and was experiencing pretty, really swollen breast, but only my left one. And it was like substantially larger than my right. I've always been uneven, but this was a pretty significant change. And I have gained a good amount of weight over the past 6 months. I'm newly married and we enjoy a happy hour here and there. And I'm, in my 40s and just don't really give a shit. So I have kind of let myself go a little bit. So part of me was like, okay, well, I guess this is just like chubby girl boobs. I guess this is just what happens as girls get bigger. The girls get bigger when the girl gets bigger, right? But the problem was it was red, swollen, and it was very significantly different than my right one. So my husband and I were like, okay, well, it's your cycle, could be a cyst, could be, an infection. Let's wait it out. Let's wait out the period and see if things change. They didn't change. The weekend of the 22nd, it was still pretty significantly swollen and red and got more tender to the touch, more sensitive. And I had started a brand new job as a teacher, and I was on my feet a lot more than usual, probably 8 or 9 hours a day where I just wasn't sitting down for more than, a small window of time. And by the end of the day, I was so swollen and sore that I had to ice my chest because I was so sore. And the weekend of the 22nd or 23rd, I felt a small mass right behind the nipple, like at 2 o'clock on the breast is what we've termed it at. So it was like thickening of the skin, really hot to touch. My breast was really red, like I said. So I had some doxycycline from a dermatologist for me and my son, because I still get acne because I'm a full package. So I had doxycycline and started taking it in the morning and the night, assuming that if it was in fact an infection, that the doxy would take care of it. It didn't. So finally, after, complaining about having to ice it and having it be significantly different than my right side, I started noticing some reddening, and I get blotchy anyway because I'm embarrassed right now, but it was on my breast and nowhere else. So I, of course, was Googling the shit out of it, and I kept on coming back to inflammatory breast cancer. Everything that I was experiencing was similar to mastitis, which, if you've nursed babies or if your wife or partner has, it's an infection of the breast that happens while you're breastfeeding, where the milk duct gets infected or clogged or whatnot, mastitis. So I had that with my kids before. So that's exactly what it was. And it felt like engorged and uncomfortable. So I told my husband, I finally finished my first full week of teaching. I loved it. I was so happy, but I was in so much pain that on the night of the 27th, which was a Friday, I decided to go to the urgent care. I have a calendar in front of me to make sure I have this right. No, night of the 28th. So the night of the 28th, I was going to urgent cares, but two of them were closed. One of them was short staffed. And then the other one, it was a 3-hour wait. So on Saturday, I went at 8:30 in the morning. I set an appointment, went to urgent care. It was a nurse practitioner, and she didn't pull any punches. She saw me. I leaned over. There was like malformation. It was like like the Stretch Armstrong guy, like where if you press it, it doesn't move. It's kind of how it wasn't good, you guys. It wasn't good. So she said, you need to get an ultrasound. And I said, if it was you, what would you do? And she said, I would go to the ER right now. So I went to the ER. Doctor walked in and he said, what do you think's going on? And I said, I think I have inflammatory breast cancer. And he was like, you. And then I took my shirt off and he was like, okay, let's do an ultrasound. And he like quietly backed away out of the room. So a gal came in. I had to wait for somebody to come from a different hospital. She came in, she did the ultrasound. And the radiologist who was on shift said that he wasn't comfortable doing a breast read because he wasn't used to it. So he said that he would have the radiologist give the results when she came in. She was coming in at 7 o'clock that night. This was the 29th, Saturday the 29th. She was coming in a week ago today. So I called at 7:30 and then I called at 8. And then the gal who was on staff in the front office sent me the results. And what I read, because it's what it said, I just Googled the crap out of it. What they found was a 1.5 by 1.8 centimeter mass at 2 o'clock. And it was hypoechoic and irregular borders. So I knew, I think I knew probably on Friday that it was cancer. I just had a feeling. And then as I read about inflammatory breast cancer, everything, all the boxes were checked, right? So there was a number for the radiologist. And by this point, it was around 9 o'clock and my husband and my kids were out to a movie. And so I was just kind of hell-bent on talking to this woman, not thinking I would until Monday. She called me at 10 o'clock on a Saturday. Her name is Melanie Coleman. She's a doctor. She's also a mom of 3 kids. And I don't know why people are so good that they do things like that, but she called me. And she said, you need to get in and get seen sooner rather than later. This is highly suspicious. So she said she would write the orders herself, which she did. My physician was out of town. So she wrote the orders herself for an ultrasound, a mammogram, and an ultrasound lead biopsy. They also wanted to do an ultrasound of this area here. So she said, this is the cell phone from my scheduler. She said I would call, she probably won't answer until after 10 o'clock on Monday, but just start calling then. And I called, probably 7:59 on Monday. She answered. She said, we can fit you in today. Let's get the mammogram and the ultrasound done. And I said, can we do the biopsy too? And somehow Southern Arizona Radiology Associates, Sarah, did everything. I went in and it was Lisa. Lisa was the ultrasound technician. The doctor's, his first name was Aria. I'm going to have to look up his last name. But they spent 2 hours with me. They did the mammogram. Then we went in and ultrasound. I told her this arm was bothering me too, which I also thought was a symptom of just getting chubby, where like I had an inflamed armpit. I was like, do fat people have fat armpits? Well, I guess I just have fat armpits now. So I was just inflamed. I was swollen. So they very delicately told me I had cancer. I mean, the biopsies were done, but the pathology reports, were going to take 3 to 5 days, but they both were, he said, this is a RAD5. I'm more than 95% sure you have cancer. And I looked at the ultrasound tech and I was like, when did you know, Lisa? And she's like, I knew right away, right when when she started the gun, I don't know what it's called. The baton. I'm going to have to Google that. So that was Monday. Tuesday, my husband's ex-wife, who has just been an astounding resource for us, saw me. She ordered an MRI for me because I feel like I'm having swelling here. I called Banner, highly recommended. I called a bunch of oncologists, but Banner's one who contacted me first. They said they could see me the following week. Long story short, the amount of people that have expedited things for me has been phenomenal. And what I will own and what I will be proud of is that I have not stopped being an advocate for myself and not stopped being pushy since the word go on this. And I think about people who don't have the resources and people who don't have the internet, people who don't have transportation, people who don't have the IQ to know what to do, where to go, who to talk to. Like, I've been extremely fortunate to have the upbringing that I do to make this possible. So there's so much gratitude, and I feel extremely fortunate already. So long story short, I was supposed to see the oncologist. I wasn't supposed to have seen the oncologist yet, but after explaining the situation to my nurse navigator, her name is Sean, and she's awesome, through Banner, she said, I want you to get in to be seen as soon as possible. I saw my oncologist on Thursday. The pathology reports came in that morning before my appointment, and she confirmed that it was a highly aggressive, fast-growing cancer. She believes stage 3. I still have a lot of testing to do. I have an MRI, I have a PET scan. They're going to have me meet with the surgeon, but all of that stuff's coming up. So those were my symptoms. I went from an ultrasound a week ago to today, where I know that I'm starting chemo next week. And I know that this is highly aggressive and I can't fuck around. So it's like go time, and it's insane. And my doctor's calling, so I'm going to answer that. This is my story, and I'm so grateful for all of you for being here for it.